As a business organization representing employers in our community, we're concerned with those priorities around healthcare. How do we help our members, how do we help community businesses manage healthcare costs, realize that they're getting the most value they can for the expenditures in healthcare, and how can they keep people healthier in the workplace? So that's one area. The second areas we're working on are around workforce development. And SALC has a long history of addressing that. A few years ago, we had a severe shortage of registered nurses that are pivotal to the hospital system as well as population health in our community. And SALC really mobilized resources, supported more educational dollars to provide over 150 registered nurses for this community. So great advocacy there. And I think the other piece is access to primary care. We have a limited number of graduate medical education spots in our community to train primary care physicians, and we need to advocate for more dollars to support primary care. We know that over 70% of residents who complete a residency in a community stay there and build their medical practice or their clinical practice in that community. So that's another workforce initiative for SALC. I think the biggest successes for SALC around healthcare in the past years, and probably moving forward, will continue to be on advocating for access to healthcare, in ensuring Medicaid expansion stays in place, in ensuring that we really try to build bipartisan support around the Affordable Care Act and the tenets of that legislation. And then I think also working on workforce development has been a past win, and we'll continue to work on that as a growing business community. I bring a really community perspective to healthcare, so I see healthcare as the third leg of the stool. SALC stands for economic and business development. We support education and advocate for education, and I think the third leg of that stool is around affordable, accessible, quality healthcare for our community to ensure that people are able to be productive members of the community. So I think that's something we'll continually work for, to advocate for affordable health care, to help businesses and employers also navigate that playing field.